So we're very, very grateful to have Dr. Mann with us. You have an excellent presentation in store, so I'm glad you're here live. And again, shout out to anyone who's with us at the live stream at the Academy. Thanks again to CFA for sponsoring that. This is really cool to have both our online conference going on and to know that we are streaming directly into an in-person event. And if you are there in Cleveland, I want to encourage you to go out and find Stacy LeBaron and Dr. G. They're board members. They're out there running around somewhere. Go stop by our booth in the Expo Hall for CFA. Say hello. But so thank you to Stacy and Dr. G, and thank you to everyone in Cleveland. I digress. I do want to go ahead and get started with our session, and thank you, Dr. Mann. I'm going to read your bio, and then I'll go ahead and turn off my screen. And again, throughout the presentation, y'all, you're going to see her slides and hear her speak, and she has some videos for us. And then at the end, we'll pop on our webcams and have a conversation on camera. And so without further ado, Dr. Kimberly Mann is the Clinic Medical Director and Primary Surgeon at the York County SPCA Spay Neuter Clinic, a high-quality, high-volume spay-neuter clinic in York, Pennsylvania. She attended the University of Pennsylvania, where she obtained her Bachelor of Arts in 2009 and her Veterinary Medical Degree in 2013. She has experience practicing in emergency medicine and primary care medicine, but has found her calling in high-volume spay-neuter. She has been with the York County SPCA since 2015 and has helped grow the clinic's impact from around 6,000 spay-neuter surgeries per year to over 11,000 per year in 2023, with a team of 1 doctor and up to 7 full-time support staff. Dr. Mann is a mission-driven individual who is passionate about providing affordable spay-neuter services to as many patients in need as possible. She places special focus on patient and staff safety, surgical efficiency, and a team mentality when it comes to running a high-volume clinic. She has a soft spot for senior pugs and special needs cats, and currently shares her home with her husband, Robert, and their 3 pugs and 4 cats. So thanks so much. Hello, Dr. Mann.
Hi, so thank you so much for having me and for that introduction. I'm just really excited to be here talking today about high volume spay neuter and how we can really make the biggest impact possible with the resources that we all have available to us. I do have my email address up on this slide, and it's going to be at the end of my presentation as well. So if anybody has any questions or wants further information or anything from me regarding this, please don't hesitate to reach out to me via email. I really want to hear from you. I also just want to add a small warning at the top of the hour. So this presentation does, like Bree said, include some short videos of surgery. So when I start talking about high volume surgical techniques, we will have some surgery videos. We have a few staff members outside the veterinary department at my organization who just can't stand the sight of blood or surgery. So if anyone here feels that way, has difficulty watching things like that, I will make you aware when we get to that section of the presentation. So again, I just want to reiterate, to make my background and experience clear, I think it's important to kind of know where I come from and what I do every day to really see where this presentation is coming from. But I started out my veterinary career working in emergency medicine. I did that for about 2 years. And during that time, it became really apparent to me that there was a lack of affordable veterinary care in our area. I had given one too many multi-$1,000 estimates to owners that I just knew they weren't able to afford. And I really felt limited with the good that I was able to do in the for-profit veterinary industry in my area. So as a mission-driven individual, you know, someone who became a veterinarian specifically to help the animals in need that need our help most, I started to explore the options of working for a nonprofit and was immediately drawn to high-volume spay-neuter due to my love of surgery. I started at the York County SPCA in 2015, really not knowing what to expect. I was jumping in to something that I thought I would like, but I didn't have shelter experience or high volume spay neuter experience before that, but really found my niche, and I'm still at that same clinic 9 years later. And I also do high volume spay neuter relief at a few other local clinics in my surrounding area. I do have up here, so I consider myself a really passionate TNR advocate. I feel like the biggest and most significant impact I make as a high volume spay neuter surgeon is in the lives of community cats. So that's why I've become a really big advocate for TNR. That's where my heart lies, in helping the animals that need us the most. And then also I was a cat person long before I was a dog person, but I do confess that I am one of those people that everything in their house has a pug on it. And these are my 3 up here right now. Again, for some more background of just where I'm coming from, so my clinic is a spay neuter clinic that is strictly focused on providing spay neuter services to the general public. We provide public spay neuter for dogs and cats, and about 2/3 of our surgeries are trap neuter returns. So about 1/3 owned animals and 2/3 on community cats. So in 2023, we performed over 11,800 surgeries on dogs and cats. So about 55 to 60 surgeries per day. And that is with 7 full-time employees. So that was me, the 1 doctor, 1 clinic manager, and 5 full-time veterinary technicians. We're open Monday through Friday. We have scheduled appointments for owned cats and dogs. And then we also accept walk-ins for our TNR program, which means we don't ever really know how many surgeries we're going to end up with that day until the end of intake at 9 a.m. So it's always a make it work day in our clinic. So right now we can do 11,000 plus surgeries per year with 1 doctor. And when I started back in 2015, our clinic had 2 full-time vets, a full-time manager, and 4 full-time vet techs. And we were only doing about 6,000 surgeries per year. So about 25 to 30 per day. So how did we get, where we were in 2015 doing 6,000 a day to where we are now doing 11,000 plus? And the answer to that is we worked really, really hard on increasing our efficiency and therefore our productivity. So in a for-profit veterinary model, the goal of a for-profit model of any business, really, the goal of that business is to maximize profit. So changes are made over time to decrease your expenses, increase productivity, and therefore increase profit. In a nonprofit model, which is what most, but not all high-volume spay neuter clinics are, we're not necessarily looking to maximize the profit from the services we provide. Quite the opposite. We're instead looking to maximize the impact we have in relation to our organization's mission statement. And so the organization I work for places great emphasis on controlling the animal population growth rate in our community. This is our mission statement up on the slide right here. So when I'm looking for a measure of success for both myself and the team that I manage in the clinic, we want to be maximizing the number of spay neuter surgeries that we're able to safely deliver to the community in order to achieve our mission. That is how we define success at our clinic. So we're going to talk about how to safely increase the number of surgeries that can be performed in a given time frame in a spay neuter clinic, which I referred to up on the slide here as SPH, or surgeries per hour. There's so many variables between spay neuter clinics that a daily number comparison between clinics is a very apples to oranges comparison. Some vets are only comfortable doing surgery for maybe 4 hours. I do 6 hours. Our last speaker, Dr. Young, said he's happy to do surgery for up to 12 hours, which is amazing. But I think if we're comparing, if we're looking at our efficiency, breaking it down into surgeries per hour is a more useful comparison. So for this audience, I don't think it needs to be reiterated, but I do want to reiterate, just to be clear, everything I'm talking about doing to increase your efficiency is never at the expense of the safety of the individual patient. We're always keeping patient safety at the forefront of our minds. We do not compromise patient care in order to get more surgeries done. And I know this is often a concern when people who are unfamiliar with high volume spay neuter hear about how many surgeries a surgeon might complete in a day. What they're not aware of is that high volume spay neuter surgeons really are essentially specialists in this small niche of spay neuter due to the huge number of surgeries that they perform over a very short period of time. And that high volume clinics are typically solely focused on spay neuter, meaning they're able to streamline their processes to such a point that several times the number of surgeries performed at a general practice can very easily and safely be performed in the same amount of time by a high volume surgeon. We're also not trying to rush through things as we go, trying to go faster. We're not running from patient to patient or being careless during surgery. We're simply making changes in our day so that we're moving and using our time more efficiently, which is what ultimately leads to the ability to do more surgeries safely. So why is it so important to focus on efficiency in a high volume spay neuter clinic? And it really comes down to what I have in bold on this slide here, that there aren't currently enough spay neuter appointments available for all of the animals that need spay neuter services, which just makes it impossible to truly achieve our mission. So there are a few ways that a few solutions to that problem. One might be, do we increase the number of veterinarians? Well, yeah, that's part of it. We certainly need more veterinarians doing high volume spay neuter. There aren't enough people who have come into this niche of the veterinary world. So I always encourage people to come take a look at what we're doing, see if it feels like it'd be a good fit for you. I always want to encourage and mentor veterinarians who are interested in high volume spay neuter, but that takes time. It takes time to educate veterinarians. It takes time to get the training. It costs a lot of money to put more veterinarians through school and generate, more staff. So that's not necessarily the easiest thing to do in order to solve our problem. Do we increase the number of spay neuter clinics? Again, absolutely. We need more low-cost, high-volume spay neuter clinics, especially in areas that are considered a veterinary care desert where there aren't access to an affordable spay neuter clinic. Again, that takes a lot of time to raise the money, to build the clinic, to get a staff. And it's, again, is just not a very easy, feasible, quick thing to do. Increasing the efficiency of clinics already in existence and vets that are already doing spay neuter is a lot cheaper. It's also a lot quicker. So I think it's kind of the low-hanging fruit in terms of increasing the availability of spay neuter and just being more productive and having more impact in spay neuter. Okay. So in order to safely increase the number of surgeries a clinic is able to perform, there's a few different focus areas that I kind of broke it down into where improvements can be made. These include, but are certainly not limited to, abiding by high volume spay neuter principles, optimizing the flow of your clinic, and then embracing high volume spay neuter surgical techniques. And we're going to go through each one of these and break them down individually. So these principles that I'm talking about, again, these are assuming your clinic exists in an area that has access to full service veterinary care. I'm not talking about, a pop-up clinic in a desert that doesn't have access to full care, or like Dr. Young was talking about, going to reservations where you're only there once a year. That's not what I'm talking about. I'm talking about a functioning high volume clinic that focuses on spay neuter, but exists around full service veterinary hospitals and shelters and other resources and things like that. So if our ultimate goal is to maximize the number of surgeries per hour we can safely do, we really have to keep our focus strictly on spay neuter. Anything else is going to slow down your surgery flow and hinder your efficiency. It can seem really easy when you're kind of starting out to just extract a baby tooth on a dog here or there, or take off a couple of dew claws, but overall doing those additional procedures is going to subtract from your ability to make as big of an impact with spay neuter. So at my clinic, the only exceptions to this are repairing an umbilical hernia on a female, since you're already making an incision in that area when you do the spay, as well as some minor wound repairs and procedures in TNR cats. Often the only time community cats are going to have any kind of vet care is when they are spayed or neutered. So we try to do everything that we can for those animals, at the one time that they might be seeing a veterinarian in their life. Everything else we refer either to a full service vet, or my clinic is associated with a full service animal shelter that has some low cost programs where they offer surgeries like enucleation, amputation, other things like that at a subsidized rate. So my clinic, we keep it focused very much on spay neuter. That way we're able to be very efficient with our surgeries. Those other things, we refer to the resources that are available in our community. So the second bullet point I have on here is healthy animals only. Healthy is certainly open to interpretation by your veterinarian, but in general, any animals that require more extensive monitoring, IV fluids, or have an underlying condition that might increase their risks of anesthesia are not considered high volume surgery candidates. Again, these patients are going to slow down the flow of surgery. They detract from the number of surgeries per hour you're able to perform. Our online appointment scheduling form is customizable, so we can ask specific questions regarding a patient's medical history, current medications, etc., and then ask for more detail via email if we're concerned that this patient might not be a high volume candidate based on how the owner answered those questions. We have some basic guidelines that all of our staff know will raise a red flag, but ultimately it is myself, the veterinarian, who will be performing the surgery that gets to make the final decision on whether this animal is a high volume candidate or not. High volume spay neuter is just one part of the healthcare provider system for cats and dogs in our community. We don't ever see ourselves in competition with other veterinary facilities. when it comes to other spay neuter clinics around us, excellent. The more clinics doing spay neuter, the bigger the impact in our community. When it comes to full service veterinary hospitals or urgent cares or ERs, we're there to complement the services that they offer, not compete with them. So things that are not high volume spay neuter related, again, should be referred to a full service vet or an urgent care so that we can focus on our specific mission of spay neuter. Another way to kind of look at this is, again, it's very easy to start prescribing eye drops or for kittens, or treating ear infections, or prescribing antibiotics for a UTI. But what ends up happening is you get pulled away from surgery to explain these things to pet owners, or if your first line treatment for something doesn't work, you're now left in the predicament of, do I now have to provide follow-up care for this patient, when again my focus should be on spay neuter. So when our clinic first opened, there were a lot of clients initially that didn't understand why, if their pet was seeing a veterinarian on that day, that every question and medical concern that they had couldn't be addressed during their spay neuter appointment. So it really took being consistent and very transparent in our aims and our limitations for the community to begin to understand that we are there to serve a very specific purpose. We execute that purpose and that mission very well, and that there are other veterinary facilities that are there to serve their purposes. So again, it really is a complementing other members of the animal healthcare system, not competing, and sticking to what our mission is. The last principle of high volume spay neuter I want to talk about is where the bottleneck of your surgical flow should be. So typically the veterinarian is the most expensive employee in a clinic. They're also the only employee who can do surgeries. And the veterinarian performing surgery really at that point should always have a patient in front of them when they are in surgery. You never want to have time where the vet is waiting on staff to prep patients for them, or to get patients who are finished with surgery off the table so that they can start on the next one. Time where the veterinarian is just standing and waiting is time and money wasted. And when we're trying to have the biggest impact possible with whatever resources we have available, that's not ideal. So every process that you build into your clinic's flow should be done with this in mind, that the surgeon should always be doing surgery, and with very few exceptions, the support staff should be doing everything else. I do get the question very often, like, how many support staff do I need for X number of vets? And that really varies depending on the efficiency of your veterinarian at that time. I typically recommend getting your vet more efficient at surgery, getting your existing staff very trained and efficient, and then gauge, whether you need additional staff by whether or not your staff is keeping up with your doctor or not. If your vet is standing around waiting or has time to jump in and do non-veterinary, non-doctor tasks, you likely need more veterinary staff in order to achieve your optimum efficiency. So we're going to move on to optimizing clinic flow. And optimizing your clinic's flow has everything to do with identifying the individual bottlenecks in your practice and making changes to relieve that bottleneck pressure. So doing this repeatedly allows you to focus on the issues in the flow that are impairing your ability to maximize the number of surgeries you can do. So each time a bottleneck is relieved, that means there's now a new area in the flow that is the bottleneck. So it's a model of constant reassessment and constant improvement. And this also means that what works in my clinic is not necessarily the right thing for your clinic. The idea is to approach your own clinic's flow objectively and start in the areas that have the most room for improvement and efficiency. Again, picking the low-hanging fruit, making those improvements, and then reassessing from there. So what worked well in my clinic was for us to assign different positions to the veterinary technicians each day. So one day they might be prepping patients for surgery, one day they might be recovering them from anesthesia, one day they're monitoring them under anesthesia in surgery. And eventually, by assigning these roles and working to make sure that each individual area was most efficient, we reached a point where every staff member knows exactly what they should be doing at any given time based on the position that they're working in that day. And it just makes the day flow so much easier because we're not stepping over each other to try and do the same tasks. We're not, at any time confused of, should we be moving on to this yet? Well, this terrifyingly colorful spreadsheet is just an illustration of, how the staff in my clinic spends each part of their day. And this is on a day where we're doing surgery on both dogs and cats. We actually have a separate one for when we're having a cat only day. So despite this spreadsheet, I totally understand that life happens, staff members call out, or things just don't always go according to plan, but it really helps us to have this by having everyone on the same page at the beginning of the day about who should be responsible for what, when certain tasks need to be completed by, and then having that structure in place just makes it a lot easier to then deal with those unexpected challenges when they do arise. So a few of the bottlenecks that my staff and clinic have identified and addressed are listed below here. And I'm going to go through them one by one. But again, I want to reiterate that just because this is the way my clinic has found it to work best for us does not mean that it's going to be the best thing for your clinic. But these are all ideas of, how we kind of looked at a situation and we're able to make improvements to increase our efficiency. So the first one is that I think this probably is universal, that preparation is key. So we have our client paperwork, our patient ID bands, our cage cards, our bags filled with vaccines and other supplies already pre-made, at the beginning of the day. We do that the day before we leave, and have everything set aside and ready to go. So this allows us to really hit the ground running when our doors open at 7 a.m. and some days we can admit up to 100 patients in the next 2 hours. Our intake runs from about 7 a.m. to 9 a.m. And like I said, we do accept walk-ins. So as far as the walk-ins go, we can't prepare for everything, but we try to have as much ready to go as possible to set us up for success in the morning. During the pandemic, we had to close our clinic for a short period of time. And when we reopened, we did start doing all of our client interactions curbside. It turned out for us that this actually made us a lot more efficient because our pre-existing lobby was very small and not built to handle the volume of clients and patients that we see. And we also realized it had some other benefits, like minimizing the chances of aggressive animals going after each other or encountering each other, because the pets all stay in their cars with their owners until we're ready for a staff member to walk them in and put them in a kennel. So again, this is just an example of sometimes things happen and we kind of have to go with the flow. But when you go with that flow, you can hopefully find some things that are actually beneficial and will help you and make you more efficient. So always keeping an open mind about changes is really important. The way we do exams has really changed a lot over the past several years, but we are in a great, efficient place now. So dogs are brought straight back to the doctor as they are checked in. They get a quick 1-minute exam and a pre-med before they go into the kennel. So this exam is not a full nose to tail exam like we're used to doing, at a full service veterinary hospital. We're doing this exam to evaluate if this patient is a candidate for high volume surgery. So I'm checking mucous membrane color, I'm listening to the heart and lungs, I'm confirming the sex, and I'm taking a quick look at the skin where the incision will be. If there are other abnormalities that I note during my exam, we document these, communicate them to the owner, and tell them how they should be following up with a full service vet. But our goal during this exam is to determine, is this patient having surgery here today, or are they being rescheduled, or are they being referred back to a full service vet? So that really is the goal of that 1-minute exam. Is this patient safe to go under anesthesia here today or not? And that's the purpose of the exam in the morning. Cat exams we do similarly. Cats are brought in their carriers. They're each covered in a towel to try and keep them calm. And then when it's time for the exam, we're getting a weight, we're doing our 1-minute exam, giving a pre-med, and then setting them up in a cage until it's time for them to be induced for anesthesia. And I think that this works really well because we're trying to keep the cats calm in their carriers where they hopefully feel a little bit more comfortable than in one of our cages. We used to bring the cats in, take them out of the carrier, put them in the cage, then later take them out for a weight and exam. And this just stressed the cats out very unnecessarily. So streamlining it all into one smooth process there has really been helpful. So the next bullet point I have on here is that the doctor stays in surgery. Staff and patients come to the doctor. This was a rule I had to impose on myself. I would get called out to the surgery prep area to, look at a wound on a cat or confirm maybe we're seeing a spay scar, something like that. And somehow when I was out there, I would see something else that needed my attention, or I would wander back the hallway to check and see where we were with sedating cats. And, I would lose time by knocking myself out of my surgery flow. So it became apparent that, the vet techs could ask me the questions that they had when they were bringing the patients into surgery. And that way I was a lot less likely to get distracted and out of my surgery flow. So the staff and the patients come to the doctor. You want to keep your doctor in surgery where they are doing what they need to do. The next thing I have on here, getting started with surgery as soon as possible in the day. So everything might not be ready for all of your patients for that day, but if things, like if a few patients have been examined, pre-medded, you have your drugs ready, it's better to start sedating and get your surgeon cutting earlier in the day rather than waiting for everything for everyone to be ready. If you're not starting surgery until everything is ready for every single patient and until every single staff member is back in the surgery area waiting to get started, you're just losing a lot of precious time in the day. And time is one of the most limited resources that we have. So we want to take advantage of every opportunity we have to maximize surgeries. So even if you think you have plenty of time in the day to get everyone done, also there are always obstacles that can crop up that are going to slow you down. You might have a surgical complication that's going to take you a while to handle. And you don't want something like that, a roadblock like that, to ruin your whole surgery day because you thought you had plenty of time to get everyone done, and now something pops up later in the afternoon that means you're not going to get to 10 or 20 patients or something like that. All right, the next thing, so utilizing your staff wisely. I kind of already mentioned this, but really, if we want our clinic to be as efficient as it possibly can be, then the doctor should be doing things that only doctors can do, which are surgery, exams, and prescribing medications. Our veterinary technicians should be doing things that only the techs can do, like pulling blood, sedating animals, prepping for surgery, giving microchips and vaccines. And then almost anyone can be trained either as an assistant or a volunteer to do so many tasks around the clinic, like cleaning instruments, wrapping surgical packs, doing laundry, cleaning cages, moving cat traps, etc. That, if we're using our staff wisely and we're utilizing, that goes from the doctor all the way down to the volunteers, that is really going to help us make a huge impact in how smoothly we can flow through our surgery day. Keeping your doctor busy. So yeah, this is sedating animals and doing surgery in the order that keeps your surgeon busy. This is something that is going to be variable, very variable between veterinarians. So each vet kind of has to figure out what works best for them. And what has worked best in my specific case is starting with dogs right in the morning. Those are the most tiring surgeries for me. So when I have the most energy, first thing in the morning is when I want to be doing my big dog spays. And then once I get through big dog spays, personally, I can then neuter a dog faster than my two prep techs can get the next one sedated and prep for surgery. So because we have the benefit of having a lot of staff, we'll also have somebody start sedating and prepping cats on our other prep table. So if I have a dog on one surgery table, then I will turn around and I have a cat ready and waiting for me on the other. And that way I can just jump back and forth and, be moving more quickly through the surgeries of the day. Lastly, so technology is your friend, 100%. We were at what we thought was max efficiency in our clinic in 2019, and that was, with the staff and software and facilities that we had available at that time. And in 2019, we did just under 7,000 surgeries with one doctor. In 2020, we changed our scheduling software to one that allowed clients to make appointments and pay deposits online. So we were no longer having an administrative person having to do all of that. And immediately we eliminated so much admin work that we were able to do 500 more surgeries in 2020, despite the fact that we were only open for 9 months that year because of the pandemic. So it made a huge difference. We didn't anticipate that it would make that big of a difference, but it really made a huge difference by lifting some of that administrative burden off of our staff. In 2022, we had hit what felt like another wall in terms of our maximum efficiency. But in 2023, we changed from paper medical records, where I was signing every chart after every surgery and handwriting medical notes, changed to a paper light system, which that change allowed us to do more than 1,800 additional surgeries in 2023 over 2022. So these aren't small changes, like these are not small changes in impact that I'm talking about. It can feel like a barrier to, spend $1,000 or $2,000 on upgrading software or something like that. But the number of surgeries it allows you to do is going to cover your costs well over that. It's very much worth it to make the small investments to make changes, and you'll have the bigger impact and be generating more income from your clinic to cover that, no problem, while also maximizing your impact with spay neuter. The software that we use also calculates drug dosages. It generates patient discharges based on the services that they received, and a whole lot more that just frees up our staff to be serving more animals. They're not getting bogged down in that administrative paperwork. So to summarize, just there are endless ways to improve the flow of your clinic. It just takes, some, like I said, objective observation and willingness to implement changes that will ultimately make the clinic more efficient. All right, so surgical techniques. So this section is mostly for veterinarians, but I do think it's really important for all staff in a spay neuter clinic, or anyone, advocating for spay neuter programs, to understand why a cat spay performed by a high volume surgeon can be easily and safely done in 5 minutes or less, and why that might not necessarily happen in a full service private practice. It also just re-illustrates some of the high volume spay neuter principles that we've been talking about, some of these individual techniques. This is the section that features some short surgical videos, just to give everyone a heads up who doesn't like the sight of blood. Not that anything is very bloody or surgery, but just to give everyone a heads up. And on the slide here, this is our clinic manager's son, who was dressed up as a vet in training during our open house. So I always like to include that photo because I want to get as many people doing this job as I possibly can. So as veterinarians in school, I also want to preface my talk with this. As vets in school, we are often taught one specific way of doing things, which does not necessarily mean that that is the only safe way to do it. Again, I am very, very focused on safety. I'm not doing anything during my surgeries that is considered unsafe or is putting my patient at any increased risk. It's just, again, having an open mind to look beyond, this is the way I was taught to do it. What other valuable techniques are out there that are also just as safe? How can we make changes in our surgeries to be more efficient? If you're a veterinarian and you're moving into a position where performing high volumes of surgery are expected, I think that you really do need to embrace at least some of these more efficient techniques in order to be successful at meeting those high volume goals. That does not mean, again, I'm not preaching to anyone saying you have to do everything the way I do it. It's just, these are techniques that have really helped me become more efficient and become speedier in my surgeries. All right, so the first concept I have up here is mise en place, which if you watch a lot of cooking shows like I do, chefs use this concept of mise en place, which just means having everything that you need for your surgery right there beside you. There's not going to be wasted movements walking across the room to get something, or everything is already there where you need it, and it's just going to make you move more quickly and more efficiently. So I have supplies for ear tipping, my surgical pack, Avogard to disinfect my hands between surgeries, and my gloves, all within arm's reach when I approach my surgery table. That way I'm not having to run back and forth across the room for what I need. Everything that I need is already there in front of me. And we use this mindset every everywhere in our clinic. So everything that the anesthesia monitoring technician needs is all in one place. Everything that our prepping technicians need is lined up on a table right in front of them. Even everything that our volunteers who are handing out paperwork and directing traffic in the parking lot, everything that they need is already in a messenger bag that they can sling over their shoulder when heading out to the parking lot to begin their volunteer shift. So just preparedness is really, really important. The next thing I wanted to mention is patient positioning. So patient positioning is also very important, not only for the surgical procedure itself, but also in relation to the surgeon. So I perform surgery with my table as high as it will go for cats and a little bit lower for dogs based on the size of the dog, because I'm trying to keep my elbows at pretty much a 90-degree angle when I'm doing surgery for the most part. And this minimizes the strain on my back and my shoulders, and it allows me to comfortably do surgery for 6 to 7 hours a day, 5 to 6 days a week. And I'm going into 9 years of doing that consistently, and I don't have, any neck or back or shoulder problems at this point, because I mindfully, am holding myself in a certain position while I'm doing surgery to not put strain on those areas. I also pull the patient as close to me as possible so that they're positioned literally right at the edge of the table. And this prevents me from having to lean over the table, which again is going to put a lot of strain on the neck and upper back. Some surgeons find that wearing surgical loops is helpful. So loops that you are looking straight forward, but your lens is directed down at your patient, so you don't have to have your neck bent at all. I have not personally begun doing that, but it's something that, if I were to ever develop any neck issues in the future, I would definitely jump into doing that. And then taking just a few seconds between each surgery to stretch your neck, shoulders, back, and especially your hands. That's going to increase circulation. It helps your body recover from being in, such a static position during surgery and with those repetitive movements. Short stretching breaks are also really, really important for your veterinary support staff. Restraining dogs, prepping animals for surgery. These are also, maybe uncomfortable static positions that they have to hold, and there's a lot of repetitive motion, when it comes to shaving animals, expressing bladders, things like that. So you want to make sure that they take those short stretch breaks. All right, so the next technique I want to talk about is incision size and placement. So with small incisions, I think the main benefit of having a small incision is that there is less interference from abdominal organs when you're doing surgery. There's also a lot faster closure times if your incision is really small. And also, another added bonus is that it's going to be less painful for your patient. In vet school, I think we were taught they heal from side to side, but the thing is that they hurt from front to back. So a bigger incision is just going to cause more pain than a small incision with, gentle tissue handling. So the truth is, when you're doing a spay, the spay incision really only needs to be big enough for the spay hook to go in and for the uterus and ovaries to come out. And if you're doing an ovariectomy, then it only needs to be big enough for the ovaries to come out, not for the uterus even. So I typically make my spay incisions about 1 centimeter long for cats, and I start at about 2 centimeters long for dogs. Occasionally, I will have to extend the incision, whether that's because I have a dog in heat and the ovaries or uterus are a little bit bigger, or if I have a pregnant patient, I certainly have to extend my incision longer to get the uterus out. But I only extend that incision once it becomes apparent that the uterus and ovaries are not going to be able to fit through the incision length that I already have. So I, find the uterus with my spay hook and start bringing it up. And only when I'm not able to, gently get the uterus out through that incision do I say, okay, I need to make my incision a little bit bigger. One thing that really helps you to keep your incision small is proper incision placement. So for female cats and female dogs who have not had a heat cycle, I will typically make my incision right around the halfway point between the umbilicus and the pubis. And female dogs that have been through heat, I'll make the incision just a little bit caudal to the umbilicus, so a little bit further cranial. But making your incision in the right area is going to allow you to get to both the ovaries at the cranial aspect and the uterine bifurcation at the caudal aspect, get them both out through that small incision. If you're making your incision too far cranial, you might be able to get the ovaries out easily, but then you end up having to lengthen your incision to get to the uterine bifurcation, or vice versa. If you make your incision too caudal, you're going to end up having to lengthen it cranially in order to get the ovaries out. So proper incision placement is really what's going to set you up for success in keeping that incision small. The pictures I have up on this slide here, so on the left it shows the skin incision on a female cat, which is about a little more than a centimeter long, and then the photo on the right is of a dog spay on a 65-pound fat pit bull, which we tend to see a lot of. And in this photo, so the uterus has already been located, the ovarian pedicle has been clamped, and then the ovarian pedicle tissue above the clamps has been cut and reflected laterally. And the point of this photo is to show how when you have a small incision, it is so much easier to keep the abdominal contents that you need up out of the body, and the abdominal contents that you don't want, like intestines or omentum, down in the abdominal cavity. Those clamps in that pedicle are not going anywhere. Whereas if the incision was bigger, the clamps have a tendency to fall down into the abdominal cavity, and you're really wrestling with trying to keep up what you need and down what you don't need. So keeping this incision small is making this surgery much less cumbersome, which allows me to do it much more quickly. And then small incisions also mean that you're going to have a much faster closure. So in a pregnant cat, where the uterus is many times its normal size, our incision can be 5 to 7 centimeters or even more if it's a very late in gestation pregnant cat, which means it's going to be 5 to 7 times as long as my normal cat spay incision. And the reason that a pregnant cat spay might take longer than a normal cat spay is not really because of the spay itself, not the removal of the ovaries and the uterus. That doesn't necessarily take any longer, but it's because of how much longer closing that incision takes. That's really what makes the surgery time longer for me personally anyways. So that just shows that the value of having a small incision and being able to close your incisions much more quickly is really going to help you move more quickly through your surgery patients. All right, so the next bullet point I have on here, this is not necessarily a surgical technique, but I think it's really, really important for high volume spay neuter surgeons to have a really superior knowledge and comfortableness with abdominal anatomy. So during a spay, we make an incision into the abdomen, and then we pretty blindly use a spay hook to try and grasp a uterine horn. And I say that blindly, meaning we can't literally see down in there, but it's not just fishing blindly in the abdomen. It's actually a very precise and purposeful maneuver, to try and get under all the abdominal contents to the retroperitoneum, turn our hook, and then scoop at the exact level where we know the uterus should be laying. And many times, the spay hook does not snag the uterus on the first go, but understanding the anatomy of the structures around the uterus, including the retroperitoneal fat, the broad ligament, the colon, etc., that allows a veterinarian to use whatever tissue they might have gotten on their spay hook to determine where in relation to that tissue the uterus might be located. So new vets who are just learning how to spay a cat or dog will use their spay hook, pull it up, not see uterus on it, and just drop whatever tissue they have back into the abdomen, go in blindly with the spay hook again. And this is, as a young vet myself, when I started doing spay neuter, this was really frustrating, and it was probably the most time-consuming part of my spays, was finding the uterus. Instead, identifying the tissue on the spay hook and then adjusting your technique of using the spay hook from there typically means if you didn't get the uterus on the first go, you will on the second, or by using the anatomical landmarks of the tissue on your spay hook, you're able to adjust your technique for the second swipe to get it. So I do have a quick video here of part of a dog spay where I used the spay hook but didn't quite get the uterus. So we're gonna see if we can get these videos to play here. Just give me 1 second. Okay. All right. So yeah, just again, that was just an illustration of spay hook use and how, being aware of what we're doing, taking a look at what you actually have. Just because you didn't get the uterus on the first try doesn't mean give up and start over again. Use that tissue that you have to kind of move around, and hopefully you can find the uterus very quickly after that. Having a strong knowledge of anatomy also helps when dealing with surgical complications. So if you have some bleeding somewhere and you don't know where it's coming from, using your anatomical landmarks, you can really quickly get a glimpse of either ovarian pedicle, either by lifting the duodenum on the right side or the descending colon on the left side. It kind of scoops all the abdominal contents away from the retroperitoneum on that side. So you can quickly get a glimpse at either ovarian pedicle. You can retroflex the bladder to see the uterine stump and broad ligaments, or even, you can very quickly take a look in the left side and take a look at the spleen, all of which are common sources of hemorrhage. But just being very comfortable with abdominal anatomy is going to make you able to handle complications much more efficiently and with less panic, hopefully, and then get you back on track for your surgery day. And then one of the most important times to really understand normal anatomy is when you're dealing with abnormal anatomy. I tend to see quite a few cryptorchid dogs and cats. So those are animals with one or more retained testicles. And understanding normal anatomy and normal development allows me to approach a cryptorchid surgery in an informed, systematic way. And it really helps decrease the amount of time that I spend in surgery trying to locate these retained testicles. We always call them kind of little treasure hunts, but usually, if you have the map already, you're able to find the treasure with not too much difficulty. Oh. Okay. All right, so the next thing we're going to talk about here is sharp dissection of the suspensory ligament and autoligation of ovarian pedicles in cats. So one of the most frustrating steps when first learning how to do spays on dogs and cats can be the breaking of the suspensory ligament. So I have this little picture up here that shows where the suspensory ligament is. It runs from the ovary down to the retroperitoneum, and typically that needs to be broken in order to get enough exposure to then ligate the ovarian pedicles. Sometimes it can be stretched and not fully broken, but usually it needs to be broken in my personal experience. So when I was in vet school, we were taught to strum this ligament like a guitar string, or try to digitally break it with our fingers. And I personally feel that this is easier said than done. It can take several tries before you actually break the ligament trying to do it this way. And in contrast, high volume surgeons will often just transect the suspensory ligament, either with a scalpel blade or with scissors. It's much faster, and it's also a lot easier on the surgeon's hands. So if I'm doing, 40 spays a day, I don't want to be manually breaking 80 suspensory ligaments. Using a blade is going to keep my hands a lot more comfortable. And then after transecting the suspensory ligament, the ovarian pedicle can now really easily be pulled up from the abdomen. Typically, it allows for good exposure of the pedicle. And then pedicle ties, or autoligation of the ovarian pedicle in cats, is another huge time saver. And it's just as safe as ligating pedicles with suture. I do have another video here showing me transecting the suspensory ligament with a blade and then autoligating that ovarian pedicle on each side. And then to finish off that knot, we just push the knot off the clamp with a gauze. And that was one of my technicians yelling, if you could hear. And then I'm going to do the same thing on the other side here. So I'm pulling up the uterine horn. I have the ovary in my left hand, and I'm using a finger to separate the ligament from the pedicle. And once I've cut that ligament, I have plenty of exposure in order to tie those vessels in a knot on themselves. And we do that with a curved mosquito, place a clamp above it, cut between, and then use a gauze to push that knot off. All right, there we go. And so doing that So getting both ovaries out, transecting the suspensory ligament, and performing autoligation on both pedicles, that only took 1 minute and 15 seconds. So you can see that by implementing these techniques, becoming comfortable with them, you're going to make huge impacts on your surgery times. Again, it's not about rushing and going quickly. It's about implementing these techniques and just making all of your movements in surgery more efficient. Now, all right. So again, I want to talk about a technique that might be different from what veterinarians listening might have been taught in veterinary school. So most of us learned what's called the 3-clamp technique for ligating pedicles. And this is the 1-2-3 click technique. And while 3 clamps are still used, like in the traditional method, the clamps are placed differently and the pedicle is cut before it is ligated with suture, making that ligature just a little bit faster and a little bit less cumbersome to place. So I, again, have a quick video of me performing that technique in a large breed dog here. Oh, you're fine. Okay. So here I have the pedicle in my left hand. I'm clicking 1 clamp on the pedicle. It's called the 1-2-3 click because you do 1 click, 2 clicks. Those are both on the pedicle, and then the 3rd clamp goes on the proper ligament between the ovary and the uterus. After those clamps are in place, I cut above the bottom 2 clamps and reflect the ovary away, and then place my ligature around the clamps, slide it down over the pedicle between the 2 clamps, and remove that bottom one. So I'm tightening the suture into the crush where I placed that 1st clamp. And I find this so much easier than trying to wrestle with the ovary and uterus still attached there. And we're going to do the same thing on the other side. So pulling up the opposite uterine horn, getting that ovary in my left hand. I'm separating the vessels of the pedicle from the suspensory ligament, cutting that suspensory ligament, and then moving on to my 1-2-3 click. 1 click on the bottom, 2 clicks for the 2nd. Those are both on the pedicle. And then the 3rd clamp, 3 clicks on the proper ligament of the ovary. Again, cutting that away. And then placing the ligature down on the pedicle before removing the bottom clamp and tightening it in there. Once that's secure, cutting and placing the pedicle back into the body. Okay. So again, that procedure, doing both ovarian pedicles in a dog, took less than 2 minutes by using these techniques. And it's not going to be 2 minutes the first time you try these, but with repetition and just making things easier on yourself with these techniques, you really, really can make a huge impact in bringing down your spay time. Okay. Okay, so tying knots. So the 2 knots I use when ligating something with suture are the strangle knot and the modified Miller's knot. These are both 2-pass ligations. You could see in the video that this is the knot that I did, and these knots are essentially identical. They're easy to execute. They're more secure than a single pass ligation, and they're really excellent at crushing down on fatty pedicles, making sure that the blood vessels in those pedicles are ligated. I don't believe that either one of these 2 is better than the other, as long as you're using an appropriately sized suture, you're placing the knot in the right location, and you're tying it securely. I will use this knot on uterine bodies in both dogs and cats, on ovarian pedicles in dogs, and on the testicular cords in dogs. I think we're going to skip this video because you could kind of already see that knot in the previous video that we watched. Well, it's going to play anyway. All right, and then gentle yet purposeful tissue handling. So gentle tissue handling is definitely a learned skill. I think as surgeons become more and more comfortable doing surgery, it happens almost naturally, but it's always good to be mindful about how you're handling the different layers of tissue when you're performing surgery. You know, for tissues that you're removing, like the reproductive organs, you can handle them with a bit more force because they're coming out of the patient anyway. But for other tissues, you know, gentle tissue handling is going to decrease microtrauma, it decreases inflammation, it most likely decreases the patient's pain level post-operatively, and I just think it's overall beneficial to moving efficiently through your surgery. One thing I have noticed that some newer surgeons struggle with is repeatedly handling the tissues. So once you have the ovary exteriorized, you just need to get a firm hold on it and start ligating your pedicle. I've seen students especially keep tugging and readjusting on the tissue in their hands until ultimately the tissue tears and they end up dropping the pedicle, which is not ideal. So just being confident and purposeful with your tissues and moving through with ligation is going to minimize the chances of that happening. And then we have set ourselves up for success for closure when we made our small incision. And so moving on to closing incisions, I will typically close the linea of a dog spay with just a single cruciate and then a single simple interrupted suture. If the incision's any longer than that, I'll use a simple continuous pattern because it's just as safe as doing interrupted sutures, but it's much faster. And then with cat spays, typically the incision is small enough that the linea can be closed with a single cruciate. And then to close the subcutaneous and subcuticular layers in these small incisions, I then use what's called a modified horizontal mattress pattern. And this closure is a really quick way to close skin incisions that are about 2 centimeters or less. I use this closure almost exclusively in cat spays, except in cases where the incision needs to be longer, like in a pregnant cat. And there are a lot of different opinions in recent years about whether you need to close the subcutaneous tissue or just the subcuticular and skin in cats. And my preferred method includes both, but again, you might find that something else works better for you. Neither one has been determined to be right or wrong at this point. I think we have 2 more short videos if we have time to do those here. This one shows me closing a cat spay incision. Okay, so right now you can see I'm closing the body wall, the linea, with a single cruciate suture. And when we're closing the linea, we just want to be opposing the tissues. We're not really trying to crank down hard on that knot. That would limit the blood supply to that area that we want to heal. So we're just doing an appositional suture there. And then to close the subcutaneous, because my incision is small enough, I can just place one single interrupted subcutaneous suture there. And then keeping that tag long, I'm going to go right into the subcuticular layer. So I'm going from caudal to cranial on one side of my incision, and then cranial to caudal on the opposite side of my incision. And then tying a knot back to that long tag in the subcutaneous layer. And then I just use the needle to pull that knot deep under the skin. And done. And you can see how that closure really almost kind of cinches everything down together and makes the incision really small there. All right. Oh, okay. All right, we're almost finished. Finally, a technique that I think more and more vets are becoming aware of and becoming more comfortable performing is scrotal neuters in dogs. And this technique differs from the traditional pre-scrotal technique in both incision placement and also incision closure. So scrotal neuters in dogs have been shown to be faster, cause less pain during the immediate post-op period, and also have a lower rate of infection. So in my mind, it has made a world of difference in how fast I can perform a neuter. So I'm really a big fan of this technique, and we have very few complications afterward. So let's watch this quick video here. Okay. And apologies for the angle, but you can see what I'm doing here is I'm making one incision into the scrotal skin. I like to pull both testicles out of my incision before I start ligating. I use a single clamp to clamp both cords. And then I am placing a Miller's knot around each cord. In larger dogs, so dogs like 50 pounds or more, I will often double ligate here just because they can have quite significant musculature in the testicular cord, and I just feel better with 2 ligatures. Small dogs, I just do 1 single ligature around each cord. All right, and then once both cords are tied off, I use a blade to remove the testicles, place the cords back into the scrotum. And then for closure, we typically just place a single subcutaneous suture in here, and that's just to bring the skin edges a little bit closer together, but we leave the incision open to drain. And you do sometimes see a little bit of bloody discharge for the first 24 hours or so. So we always make sure to warn owners of that that's normal. But the closure is so fast because you're literally just placing 1 simple interrupted suture here. And you can see how fast using that technique was. That dog neuter was done beginning to end in less than 2 minutes. So to bring it back to what really matters, bring it all back to what really matters, we focus on our efficiency because that's how we are making the greatest impact possible with our spay neuter efforts. And this is a picture here of my team. Last year, we hit a new record we did 11,862 surgeries last year, but this was when we broke our record of 11,000, and we certainly stopped to enjoy that moment and had a little party at the end of the day. And then on the right here, you can see just implementing those changes I've talked about have had a huge impact in the overall number of surgeries we are able to provide to our community with the same resources that we have had. All right. I know we went over a little bit, but I'm certainly happy to take any questions. And then I do have my email address up here again if anybody would like to follow up and ask questions.
I was saying thank you to Dr. Mann. And I don't know why, but I always love those surgical videos so much. As a non-veterinary person, like I am never the person in the surgical suite, but I always enjoy them. Like I'm not a vet, but like I love Grey's Anatomy, so it's like an episode of that or something. I don't know, but I do want to extend our gratitude to you for showing us how your clinic works. I think we just have time for a couple questions.
Sure.
The top of mind, many people want to know if you could talk again, give us the name of that software you mentioned for the scheduling and then the admin paperwork side.
Yep, so we use Clinic HQ, and we've been using that since 2020. It is built specifically for high volume spay neuter clinics, so it kind of seamlessly fit into what we were already doing. There are lots of different ways to utilize that software, and we don't utilize all of the ways that it can be utilized, but each year we kind of are using an extra piece here and there, which has helped decrease the administrative work for our staff.
And so it's amazing what just a little bit of technology can do to help us, those numbers you mentioned, because, just introducing, I guess, the scheduling, you said it increased your surgeries 800 that year, I think you said.
Yeah.
And then the other one was like 1,800 or something, right?
Yeah, before using that, automated scheduling, we had gone from being scheduled about 7 to 10 days out in advance. So we were fully booked 7 to 10 days in advance. Immediately when we started using that, it immediately jumped to 3 months in advance. We were scheduled fully booked for 3 months out. And at this point, we're now scheduled for dogs 5 to 6 months out. For cats, it's only about 2 to 3 months. Luckily, we're more limited on the number of dogs we can do. So that's why they're scheduled a little bit further out. But yeah, it also is what people want, which is to make online appointments. I don't know how everybody else feels, but if I have to call somewhere to make an appointment, I'm a lot less likely to do it rather than just hopping on my phone and, scheduling something online. It's a lot easier and it removes a barrier to spay neuter, honestly.
And so one of the questions, for our veterinary friends who are out there watching and thinking about, maybe getting into this side of things, and something that we've encountered at United Spay Alliance is that not every vet feels confident, hopping into that high volume spay neuter space, seeing you on these videos and how efficient, how every single move is happening for a reason. There's, thought behind every piece of it. So, I mean, how long did it take you to learn that? How daunting is it for a veterinarian that has not been in this space before?
Sure. And my intention is never to make anybody feel overwhelmed or anything like that with the videos. It really is to show how, with repetition and becoming more and more comfortable, how simple spay neuter can become in most cases. So when I started doing high volume, I was doing cats only, and I started, I think, at 15 to 20 a day, which at that time felt very overwhelming to me. But I had other vets at my clinic that I could learn from. So I had support there. And I would say for anybody who is interested in, dipping their toe into the high volume spay neuter world, first of all of us who are here want you to desperately. We need more people doing this really important work. And I would say just reach out to any high volume clinic around and ask if you can just come see what it's all about, because more than likely they are going to be thrilled to be able to show what they do to somebody else in the veterinary industry, and hopefully, get you working alongside them or get you trained and doing spay neuter elsewhere. I also want to just reiterate that those surgical techniques that I was talking about, there's no reason for those only to be performed by high volume spay neuter veterinarians. If you're a veterinarian working in a full service practice and you do surgery 1 or 2 days a week, becoming more efficient at spay neuter is going to help you fit more spays and neuters into your 1 or 2 surgery days a week. So again, it doesn't necessarily mean because you're not doing high volume spay neuter, you can't take something from that presentation. I think everybody, and myself included, I'm always looking for new ways to just be a little bit more efficient or get a little bit better at surgery. So hope that answered your question.
Oh, it did, I think, and that's a very important point to make, and that is something that we talk about again here at United Spay Lines, that these surgical techniques are not just for nonprofits or not just for shelters. They are a best practice because of their safety, because of their efficiency, and that
Absolutely.
There's absolutely room for them to be more widespread in their application. All right, so I do want to thank you, Dr. Mann, again for an awesome presentation. I see some folks are looking for the slides, and so if you go into your handout section, there is a file called Combined Slides, and you're going to see the slide presentations from pretty much all of our speakers. I triple checked Dr. Mann's slides are in there for you, along with everyone else throughout the weekend, so I encourage you to go take a look at those. But I'll say thank you, Dr. Mann. We are going to take a very quick break now.